Está muy bien la cara. ¿Ah, sí? Sí, incluso bueno, sí, sí, estaba mal. Me gustaría que me cerró todo.
Hello, my amazing Americas region. So we're going to start with this America webinar, which is going to be called Maternal Health and Access to Safe Abortion. So this webinar, we would like to introduce a series of webinars for the Americas region because we would like to get involved more internationally because we think we are lacking some international involvement. So we're going to start with this amazing SCORA webinar. As I said, this is called Maternal Health and Access to Safe Abortion. So we're going to start with the agenda. We're having this agenda. First of all, we have the introduction. After that, we're going to have international facts, relevance to our region, facts of our region, and we're going to count with one of our externals, which is IPAS external, which is the road so far. And after that, we're going to have some tips from our SCORA D and also our regional assistant for SCORA for the American region. And after that, we're going to have the question and discussion space where we're going to be answering all your questions that you're going to, if you want to leave some question on the YouTube page, we're going to be answering at the end. So if you want to ask straight a question to somebody else, just please feel free to ask. So first of all, we're going to start with introduction. I would like to be really happy to introduce yourself, which is our SCORA D and also our SCORA regional system, which are together. So they're going to start presenting themselves. Can you just present yourself, please?
Yeah, so I am Carlos, the current SCORA director for the IFMSA in this term, and I'm super happy that this webinar is taking place, and especially that it's related to this subject. And yes, I will be presenting to you a brief introduction on the subject and some international facts.
Now it's me, so we're sharing today. My name is Carlos, and I'm for the Americas. So cool to this space, because I believe it's really important, for a region to actually discuss more about social minorities and what is happening with them, and with this topic in specific to actually merge some behaviors we have had in other focus areas that we have worked in SCORA in the past, and I think it really touches our skin, as an American people,
Thanks.
More relevance for the region now.
Okay, thank you, Carlos. Now we're presenting one of our externals, which is Cecilia Espinosa from IPAS. Would you like to introduce yourself, please?
Hi, everyone. My name is Cecilia, and I'm one of the youth advisors at IPAS, and we have been partners with IFMSA for 5 years now, and I will be sharing more about this partnership and why it's so important to work with safe abortion in the region. Thank you.
Thank you, Ceci. Now we have our regional director. Would you like to introduce yourself?
Hello, everyone. My name is Ignacia. First, I want to thank you all for being here, for trusting in this new initiative that is America's webinars. We really hope you take advantage of this opportunity of learning about a very important subject in our region, which is maternal health and access to safe abortion. So once again, I want to thank our involvement assistant, Diego, for creating this instance of knowledge and capacity building for all of us, especially the ones that are more interested in SCORA. So I really hope you enjoy the webinar and ask a lot of questions at the end of it. Thank you.
Thank you, Nancy. So we're going to start with the agenda. We're going to start with the international facts, which is going to be given by our SCORA D. So I'm going to leave the mic open to Carlos to start with this.
So first of all, welcome to you all, and as Diego said, I'm going to give you some insights on international facts, but also try to discuss why it's an important subject that we should tackle. It will be a brief introduction, a general a general and brief introduction to the subject, and then Carlos will talk more about regional data and regional related facts. So, why maternal health and access to safe abortion? No, sorry, can you go back, Diego? So, as most of you know, maternal health is not only about access to safe abortion, but we in the IFMSA have been working a lot on that specific subject thanks to IPAS and the work that was developed with them a few years ago. And we've started to become a great advocate on the subject, especially because we believe that it has such an impact into public health and human rights. And that's why we wanted to focus especially on this subject for this webinar, and why we think it would be useful to build more capacity on that, especially in the Americas region. So next slide. Yeah. Just to get started, I'm just gonna introduce you to the topic of abortion. What is abortion? What is like the concept of abortion? So for us, abortion is the termination of pregnancy before fetal viability. It can be like spontaneous without any deliberate intervention, like what we normally call miscarriage, or induced, which is what we're going to focus throughout the webinar. Just to classify it a bit also, abortion can be either safe or unsafe. When it's safe, it's when it's performed by people with the necessary skills and in an environment which is meeting the minimal medical standards. And when it's unsafe, it's when the procedure is performed by people that don't know what they are doing and lack the training and skills. And also in an environment that fails to meet the minimal medical standards. Also, we can classify it into legal versus illegal. We always say that abortion is legal under certain circumstances, and when we say that it's illegal, it means that it's totally forbidden in a country under any kind of circumstances. When it comes to unrestricted versus restricted, we all know that sometimes law isn't everything, and even though in some countries it may be illegal, women's access to safe services may be restricted, like either for like national guidelines that impose barriers, abortion stigma, the cost of the services, and lack of access to the facilities that offer the services. Those are all barriers that keep women from getting access to safe abortion. So also we can talk about voluntary versus forced. Obviously, when it's voluntary, it's an abortion that is done deliberately and with the purpose, under the woman's consent and free choice. And sometimes it also happens that there's forced abortion when the woman is pressured or physically forced to terminate the pregnancy. So next slide. Okay, so what are the barriers to safe abortion? We were mentioning before laws, stigma, and healthcare systems that are not adapted for the women to get access to this service. And the main barriers are like legal and policy barriers, which can include like limit indications for like safe legal abortion, or mandate waiting periods, or require signatures of multiple providers. They can also either be social and cultural barriers, like gender discrimination, inequality, poverty, and abortion stigma. And it can also be health system barriers, like lack of healthcare facilities providing safe abortion services, lack of abortion providers, or lack of healthcare providers that are not capable of providing such services or are not committed to that. And also low quality of the care, and as we mentioned before, the cost of the services. So next slide. Okay, so this is one map that I really like and that I think that it's really useful. It's from the Center for Reproductive Rights, and it shows how like the world's abortion laws were back in 2013, which I believe they haven't changed much since then. And as you can see, the more restrictive policies and laws in the whole world are like mostly like located in the African region and in Central and South America. There's only 6 countries in the whole world that have totally illegal abortion. 4 of them are in actually in the Americas. They are in El Salvador, Dominican Republic, Chile, and Nicaragua. And also we also have the Holy See, like La Santa Sede, and Malta, like in Europe. And next slide. So we were mentioning before that not granting access to safe abortion to women can have like multiple and profound impacts into public health and human rights. So those are some facts, some international facts that are like relevant enough and quite shocking about the consequences and magnitude of the problem we're talking about. So 21.6 million women experience an unsafe abortion worldwide each year, and 18.5 million of these happen in developing countries. And almost 50,000 women die from complications of unsafe abortions each year. As well, relating it to maternal death, death due to unsafe abortion remain close to 13% of all maternal death. And next slide. So we were, like I presented to you before, the map regarding the policies and laws in a global scale. And as you see, the biggest amount of unsafe abortions in women aged 15 and 44 years happen in the places where the laws are more restrictive, meaning that obviously women that are not granted an access to proper legal and an abortion will seek for other methods to carry on with the pregnancy terminancy. So next slide. So as you know, as I mentioned, IFMSA is committed to tackle this issue and to work all together for that. We currently have a program which is on maternal health and with a specific focus on access to safe abortion. And we also had a policy statement. So we built a lot of knowledge and capacity about this issue through especially SCORA and the IPAS workshop that we have in all our regional meetings. We advocate and we try to make sure that the message gets to the people that access to safe abortion is a human right, and therefore any woman should be able to get it if needed. Next. So these are the sources that I like the most to get information on this subject, especially the numbers 1 and 2. I think that like the first one is the map, the Center for Reproductive Rights, where the map that I showed you first come from. And the second one is the toolkit that was developed with IPAS and IFMSA, the Youth Actor for Safe Abortion, in which our workshop that we have in the regional meetings in GAs is based on. And those two are like really wonderful resources. And number 3 and 4 can also be useful. And I used some of the stuff on the sources to build this presentation. So that will be all from my side. Now I will leave the floor to Carlos, our wonderful regional assistant for the Americas, and he will talk more deeply about the subjects related, this subject and contextualized in the Americas region. I think that he has like 15 slides to present to you, so it will be intense, but I'm pretty sure that really useful for the whole region. So.
Okay, so hi everyone, my name is Carlos. I'm your regional assistant for the Americas for this year. Well, I'm actually like Colombian, but I live in Brazil like right now, so it's pretty hot today. And okay, so before starting, I wanted to thank you, thank everyone that is like actually watching this, and thank Cecilia for accompanying us today. Because above all, we want for women like to be heard in this space, you know. And well, I'm going to introduce you to a little bit more, you know, to the reality that we have right now in the region, but as well, what are you know, like the things that we have done right now. Like, why are we like discussing this in the Americas as a whole? So, Maternal health and access to safe abortion. It's a little bit like a little bit focused on safe abortion specifically because maternal health is much more than safe abortion. We developed like some major spheres within the region. One of them that has really like bomb right now is obstetric violence and humanized birth, as well as breastfeeding, access to safe abortion, as I said before, chronic diseases that affect women. All of these are like a little bit like of what maternal health englobes, although we of course prioritize some topics like from others depending on the relevance that we have in a region. So we have several axes in which we can develop these topics within a region. It's about like talking about maternal, sexual, and reproductive human rights, women's rights, taking into account the United Nations Declaration of Human Rights and the UNICEF Children's Rights are like basically the like our ground-based theory that we based on ourselves to speak about like these topics. I put like a little how do you call it? Asterisco. Asterisco is like and yeah, an asterisk in maternal because right now what we're talking about when we talk about maternal health or maternal issues, we're not just referring like to a concept of a socially constructed women right now. We're talking actually about like new ways of sharing what we think about what a family is, and we're sharing what we think that a woman is because right now like the term of like women it's so like broad, you know, it's like really like a term that has taken like many directions. So we're not gonna like stand there just for you to take into consideration that maternal is like a way like gruesome way, you know, speaking of many subjects. Okay, so moving on. I wanted okay, so yeah. Thanks, Diego. So why maternal health and access to safe abortion in the Americas? First of all, like we like, as I told you before, we like to mix a little bit more like our focus areas that we have discussed in SCORA and the Federation in the past years. The first of all is of course like gender-based violence that our women suffer every single day, every single year within the Americas, and we all know the numbers. I don't think I really need to like enter in this situation, well, in this topic, but definitely take into consideration that access to safe abortion or having policies that benefit safe abortion is actually battling gender-based violence within a society. It is a political statement that helps emancipate women for their own rights, the rights for their bodies, and their ability to speak for themselves. And Latin American cultures characterize themselves for religion-based stigma, and that is another thing that we have battled a lot in the Americas, basically because we all like guide ourselves like nationally and sometimes politically in the Americas by religious-based theories implemented, by the Catholic Church or other types of cultures. And that reflects ourselves in a society and reflects ourselves in what our doctors think, and what a medical public health system prioritizes within society. Because right now, we need to understand that doctors, like future health providers, and not only doctors, but as well, like nurses and other health professionals, are a social education media. We are a space for people to speak up and to educate people in terms of what their rights are within a public health system and what we can do for everybody to build it up and each time make it better. So that is why we need to identify social factors that are involved in a health disease process, and I'm going to talk about this a little bit later. But it's about respecting sexual and reproductive human rights, and to do that, we need to, of course, advocate for public policies that involve social factors and social minorities in a social context. Okay, so yeah. So speaking about what social determination of a health disease process is, it's an overlapping of the biopsychosocial model, that speaks about not only you having biological and psychological and social well-being, but as well you have a social determination nowadays for those three specific areas that were described by the WHO a few years ago. And yeah, like this model right now like suits lots of the situations that we're having in the Americas, because it actually merges like in a relationship between public policies and private interests within a public health system. And that's far away what Level and Clark like once stated, you know, that our health only depends on the social relationships that we have within each other. Yeah, it does, of course, but it also depends on what we construct as a public, you know, like as a popular force for us to have within a public health system. And that, of course, means that we need to like include like public policies that are going to like benefit not only like the majority, as we call it, but also like social minorities, as I mentioned before. That all of this like is important because we see mothers today as a workforce for society. You know, mothers are workers. Mothers do not stay at home as we all thought they did, you know, like some years ago. The role of the women in society is much more than that. And right now, we don't have inclusive policies in the Americas that actually let us like explore that within our society, you know. So. Okay. So this, I brought this infographic for you guys because we actually need then like to enter now in maternal health. So what are pregnant women dying from? So we see here, this is from the WHO, 28% of pre-existing medical conditions by exacerbated by pregnancy, such as diabetes, malaria, HIV, and obesity. And we see in the third cause, 8% are because from abortion complications. So all of these factors that we like include maternal health. We're going to focus more on abortion today, but I wanted you like to see the like the bigger, larger picture that actually all of these factors that I'm citing here are socially determined by something or someone or a private manner or in certain countries where, well, of course, abortion is legal, like public opinion also is a social determinant, and public force is also a social determinant. So it is, of course, like something we need to fight for and we need to identify. Okay, next slide, please. So I just wanted to bring you an example just to conclude. Okay, so here in Brazil, actually, like right now, it's really the term like about like the term abortion. It's really like peaking fire because we have like a law project right now like going on that actually like criminalizes every single practice of abortion, and we had like a great social repercussion about that. But this movement in Latin America emerges from like these states specifically because there is not only like the lack of access as well the stigma and as well the social determination to not do it, you know, like not about like what your religious like beliefs are or whatever. It's what you socially are expected to be or to do, and that is something we need to change our minds of as health workers, because we are as well like gathering all this information every single day from every single patient, and that will not help us like be preventable or, you know, like be of help in any way like to someone's life, because as we know, like health surpasses, you know, the consultory, surpasses the hospital, and of course that is like super important to identify. So in Brazil, this example happened last year. There was a patient of 58 years old. She was pregnant and she was forced to give birth in a hospital. What I mean forced is that she was put like detained by the police and sent to the clinic to have a baby, which like a baby she didn't want to have. And of course it was she was handcuffed, and it was like it was all over the news, you know. And that was like the first social example I saw, like, okay, there's clearly something going on, and
there's clearly something we need to discuss about, like, as future health workers, for this not to happen. I don't think I need to like go further in why this is wrong, but it is a clear example that, okay, like, there's certain situations that we need as health workers, like, to support people in, and this example, like, was actually one of the major motivations that took me, to discuss this today. Okay, next. So facts from the Americas, this is what I'm going to basically exhibit for you guys. In 2008, the annual estimated rate for abortion in the region was 31 abortions per 1,000 women from 15 to 44 years. And the rate for safe abortion of those was 2 abortions for 1,000 women. And these numbers take into consideration legal changes taken in Colombia and Mexico City, and Mexico specifically, like, the legalizations are by state, so that's also important to take into account. 95% of women are able to have a child. Well, 95% of women that are able to have a child live in a country today with restrictive abortion policies in the region. Well, that is basically everyone. So yeah, we have a lot to do. There we go. Okay, so this is from the Gutenberg Institute. It shows basically like the rates of abortion in Latin America and the Caribbean. The lighter orange represent the numbers or statistics of unsafe abortions, and the darker orange of the safe abortions within the region. And we see that, of course, like in the Caribbean, where Cuba is, for example, we have lots of numbers in safe abortions or other like more permissive policy statements that let us like have access to safe abortion. Okay, so of course, when we have like a political and social disadvantage, there are more suitable like opportunities, or there are more opportunities for a person to seek for a worse healthcare service and worse professional team to accompany you like through abortion process. And that is like, we clearly see that in Latin America, in South America principally, where not only you don't have like a good infrastructure, for doing several procedures that we see, but as well, like people in the rural areas suffer a lot because of not having even universal health access. And this is like the second quote the second fact I put on there. For women in Guatemala that have had an abortion, the proportion of women that seek for unsafe methods to proceed with an abortion was 3 times greater in women with rural and low socioeconomic background. So again, speaking about social determinants of health, I mean, when a country like has like these precarious like situations within the countryside, and on top of that, you have policies that are not socially open for you to attend to, then you're going to be basically like a person, like an individual, like with no health access at all, not even when you don't have like access to education, and everything, like everything becomes then like a social determinant for you, and like a weight, like a weight for you to take decisions about. Next. And the last one is 10 to 20% of women that need healthcare after an abortion procedure do not receive the resources needed by providers. And I put between parentheses, this is a link actually to obstetric violence. And the reason why is this is actually it's not stated in the fact, but like we can discuss about this, that maybe the cause, of those 10 to 20% of women that need healthcare and are not given that healthcare after an abortion procedure may be caused by several things. For example, stigma from health workers, or not inclusive policy statements, or, as I said before, a stigma, religious-based stigma. These factors, like contribute to situations like these to happen. of course, like my, I don't know how to say it, but my like objective with this presentation specifically was not about like, you know, like give you guys like the blues, you know, like the bad news that we have lots of things uh going wrong in the Americas. But the thing is that are actually like evidences that we need to take into account for us to think critically about what we are having as a health system within our countries, and think critically if actually universal health access is universal health access because we have a public health system, or because we have as well a social like determination from a public opinion over it. And that, I think, it's what we need to discuss in, I don't know, like as a whole, not only for mental health and access to abortion, but as a whole. Next. Okay, so these are the sources that like I base myself on. So you can check them out anytime you like. I really like the first one because it's actually like a Latin American perspective, you know, of violence against women in several aspects, and one of them is centered in health access specifically, and this topic we're talking about today. So I hope I was like from self-help. If you want to discuss about anything afterwards, we're gonna have space for that for your questions, and yeah, that's basically it. I think now I'm gonna say hand the floor to Ceci, which is representing from IPAS, who is a dear friend, and I really love her. So please give her a warm welcome, and the floor is yours.
Gracias, Carlos. So, hi, everyone. I introduced myself before, but I wanted to just introduce myself again. So, for people who just started like looking at the presentation now. So, I work for IPAS. IPAS is a partner of IFMSA. And I'm one of the youth advisors, and I have been working with IFMSA for the last 4 years. IPAS, just for people who are not familiar with this organization, is a global non-governmental organization dedicated to end preventable death and disabilities from unsafe abortion. So IPAS work with different local, national, and global partnerships, and we work together with others to ensure that women can obtain safe, respectful, and comprehensive abortion care. And can we go to the next slide, please? So as organization, we have been working with IFMSA for the last 5 years, and here you will see a little bit of the collaboration timeline between IFMSA and IPAS. And everything started in 2010 when IPAS was invited to attend one of the General Assemblies in August 2010. And that was like the first time that one of our staff members were able to facilitate a workshop on safe abortion with IFMSA. Obviously, this collaboration has evolved during the last 5 years, and obviously we have made a lot of progress and a lot of amazing stuff together. So you will see in this timeline how we have been taking part of like different general assemblies and regional meetings. For example, like in the orange color, you will see like when different IPA staff, like for example, have like provide technical assistance to the regional assistant on how to organize the SCORA sessions and specific to safe abortion. But also other colleagues from IPAS have also attend the regional meetings and conduct like abortion sessions during the SCORA sessions at the regional meetings. So, but I wanted to highlight some important moments of this collaboration that Carles and Carlos mentioned before, but I think they're very important for the history of our collaboration together. One is like in 2012, IFMSA released a policy statement on sexual and reproductive health and rights, and for the first time this includes the right to safe abortion. Later in 2013, SCORA adopted abortion as one of their 5 focus areas. So this obviously had helped to increase the work that IFMSA is doing around this topic. And later in 2014, in another General Assembly, IFMSA approved a policy statement on safe abortion. So this work, it's embedded on IFMSA policies, and also later, I think it was also in 2014 that the program on maternal health and safe abortion was approved. So as part of the collaboration with IPAS, Carlos mentioned this before, but we developed together a training toolkit that is called the Youth Act for Safe Abortion. That is basically a 3-day workshop agenda and activities that allows medical students to receive a training and a capacity building on safe abortion, usually during the pre-regional meetings and assemblies. And this workshop has been used in different trainings and trainer of trainers during the last couple of years. So you will see later at the end, you will see here at the end of the timeline how we have, especially SCORA official has facilitate these trainings in different meetings in the Americas, in Africa, Middle East, and Asia Pacific, but also at the GAs in Macedonia and Istanbul and others. So this is a work that we continue to increase, and right now we are working in a strategy that it will guide the work between IPAS and IFMSA for the next couple of years, and obviously we will have more to share in the next months. Just to continue with this, one of the reasons, because what I like to present is like why this is important for IFMSA. So I wanted to share with you just an example from the United States. I don't have like data specific for the Americas, but I want to show you this example because this will give us a good way to understand why this is so important. So in the United States every year, there's around like 1.2 million abortions. So by the age of 45, more than half of all the American women will have an unplanned pregnancy. And for all these women that have these unplanned pregnancies, at least like 1 every 3 women will have an abortion. Abortion is legal in the United States, but there are a lot of barriers in state by state because there has been obviously a lot of opposition on the topic. But it is important to mention that abortion is a safe procedure. That usually we have this idea of abortion as like something that is very negative, the women will die from it. No, it is very safe procedure, and less than 0.05% of patients experience complication in the first trimester procedure. So this is obviously for the United States, where services are legal and are like implemented in the safer way. But it is important to have in mind when we're talking about medical schools, this data that are included in this slide. That is like in the United States, 44 of medical schools offer no preclinical coursework on abortion care. And this is like a huge percent. Even like it's not the majority, it is still like 44%. So 4 out of 10 medical students that graduate in a medical school in the United States will receive any training on abortion care. Then when we're talking about OBGYNs, at least 25% of them will not receive any specialized training on abortion. And we're talking about OBGYNs. So this is a very important fact. But also what happened, and we have mentioned before, all the barriers that women face, even in countries where abortion is legal. 97% of the OBGYNs in the United States will find patients that are seeking up for abortion services, but only 14 of them are performing them. So this gives us like a clear idea on how there are so many barriers for women to access to the services, but also the same medical students don't have necessarily the capacities or the skills that they need to provide comprehensive abortion care services. And obviously this gives us also that even like when abortion is only one of the aspects of comprehensive medical education, the absence of this training in the medical curricula, it tells us a lot about like the lack of adequate training for essential reproductive health care alongside of contraception and miscarriage management. So this obviously will have a huge impact on the services that women are receiving. And this is why it is so important in the role of IFMSA to prepare their members in a better way to have this kind of training, because it gives a lot of like information and a lot of evidence, and it helps students to clarify the myth and the misconception that they have around this topic. The next slide. So just to finalize my brief presentation, I wanted to share with you some of the quotes that we have from like documenting the work that we have been doing with IFMSA. And I think that sharing this is very important because it will help you to understand why this is also so important and why this is a priority for IFMSA. So these are 3 quotes from different students that has been member of IFMSA and has been leading this work for SCORA, but also from the regional, for an IFMSA in the Americas. So for us to be advocates in global health, I believe that we need to be educated on abortion. Through IPAS, we can learn more about global health issues that are not talked about in some countries and curricula. We need to see it as part of IFMSA global health goal. Another student shared with us, we are going to shape healthcare in our countries. And for people to have a chance at respectful healthcare, we need to talk about the hard issues. Obviously, as I mentioned before, this is very key, because if you don't learn about this, obviously the work that you're doing is not necessarily the most comprehensive one. During the training, participants had the opportunity to see how they, as future healthcare providers, have the chance to change things that happen in what decisions they will take in specific situations that were discussed. That was the best part of the training when we discussed the cases that had happened in my country. It was the part that had more impact because the students realized how this kind of decisions were in their hands. So obviously, this is just like a brief, like a little bit of an example of like what the impact that the training had on some of the students, and the importance of the talking about safe abortion and learning more about this topic in as part of like their work of SCORA and IFMSA in general. I will continue here, so if you have questions, I can answer them later. Thank you.
Okay, so the next space is to open the mic for Carlos and Ceci. So maybe they can give some tips for NORAs, for NMOs, for LORAs, or for any kind of medical student that wants to do something locally. Do you have any kind of recommendation? What kind of activity could they do on their national level? Where can they get information, etc.? So I would like to open the mic for Carlos and Carlos first, if they have any idea.
Okay, so okay, wait for it. Is it on? Yeah. So I think the first thing we need to like understand is that, as I told you, this is a social construction about like everything we have talked about like within the federation. So in order to have that social construction, we need to hear like people. You know, we cannot like center ourselves specifically in what we are given within the medical faculty, because we have not like taken lessons about this at all, and we'll never will probably. Like even worse than like even worse like in an American context, you know. So like get to the streets, you know, like speak to people and talk to people like what are their needs, because they are actually the ones that are going to tell you like, doctor, I really feel like terrible, you know, when you treat me that way, you know, or when you actually like say something, you know, or violate my rights, you know. And the second thing is about like trying to understand people like about like in terms of like in which ways are the best ways in which you can educate them about their rights in terms of health, in terms of like getting to actually like embrace themselves and embrace their bodies and have like their rights for their own, and actually like help them understand that it is important, you know, to stand up for them, you know, and to exert them as they can. You know, I think that's the best way. The best projects in the Federation have been that way, you know, are projects that are actually like social inclusive and take into consideration not only your idea about what society wants, but actually get to the street and listen to them.
Um,
We're gonna change mine.
I would like also to emphasize what Carlos said about listening, more specifically focused on when we talk about abortion, which is by all reasons like a sticky and like sometimes really tricky topic. So regarding what he said, he was saying about listening, you also need to understand that like the point of view that you may have is not the same that some other people have, and you don't have to impose your opinion. You don't have to shove down anyone's throat what you think, and always try to be considerate and provide constructive, like build your speech around a constructive and evidence-based methodology, and try to pass on as much information and as you can. But you cannot forget that not always your perspective will be the same as from other people. You need to be mindful and thoughtful about it, especially when doing street campaigns or facing this problem with people that you don't know much about and that may not share the same background or like, yeah, go ahead.
And in this case as well, like talking about specifically then in maternal health, and this is something we actually discuss with Ceci a lot. Actually, as I told you now, like maternity and like the term like women has been changing like in the past decades. And for example, right now we also have taken into account like transgender men having access to safe abortion, because 40% of transgender men actually pass through unwanted pregnancies. So that is also something we have to take into account, you know, like speaking about everyone, you know, like in a really global way. I think that's the best, you know, tip, you know, if you want to construct a project or a, you know, like a campaign, or even like you know, like an exposition, a webinar, whatever. Like take everyone like for granted.
And be inclusive.
Yeah.
So, like,
I think we can pass now to Ceci.
yeah, Ceci.
Thank you. Yeah, no, I think that this work obviously has to continue to evolve, and I think it's what Carlos was saying about the importance of working with other groups, and especially with transgender men that usually are invisibilized from the services is important. And I just wanted to say something about why it's so important that IFMSA is doing these trainings in the regional meetings and the general assemblies is because as Carlos was saying, like, this is not to impose a view or an opinion. It is just to facilitate evidence-based information to all medical students around the topic, and also to have a new perspective on why it is so important for medical students to learn more about this issue. Obviously, we will always face like a stigma, and there will be a lot of like misunderstanding about this topic, but we need to continue to inform inform us about why this is a key issue, especially in a region where we have like the most restrictive laws on abortion. And just to like continue to clarify our values and understanding like why women make these decisions, like that goes beyond like or on opinion or not about the topic. So it is important that you as future healthcare providers also have the training and the capacities that you need to provide like comprehensive services to women, but also to all the people who come to the services. And they get the information that they need, and this information is as I said before, evidence-based, and it's not based on our religious or personal beliefs.
Okay, great. So we will now would like to open the mic for any questions from the people watching the webinar right now. If you're watching the webinar, please notice there is a chat box in the YouTube webinar. So if you have any questions, please go ahead and we will try to answer them right now. If they're not, we will have to thank our externals for the presence and Diego for organizing this amazing event. So I believe there are no questions so far.
Yeah, I would like to ask something. You know, I'm Mexican, so I saw the statistic that Mexico City is one of the cities when we can have like safe abortion and it's legal. But I see one of the main problems that we have is like in Latin America, it's like religion. So I don't know if you have any way or any tips for all the NMOs to help to break this barrier, which I think is the main reason why we don't have like a legal way of safe abortion in most Latin American countries. I know, for example, US and Canada, which are not like that religious like we are, they're not having this problem, but I think this is one of the main problems. So I would like to ask if you have like some tips for us to advocate or to try to change that barrier, which is, I think, one of the main problems that we have as Latin Americans.
One of the most important things for us is to learn about the legal framework in the Americas. And yes, we have like four of the countries that criminalize abortion completely, and but one of the main reasons because women don't have access is because we don't really know about the legal framework. Like excluding Chile, Nicaragua, El Salvador, and Honduras, and Dominican Republic, they just changed the law, so hopefully the new penal code will change this in December. But there have been a lot of like positive changes in the region. So for example, Bolivia recently allow abortion for in cases of rape. Also, Brazil have made progress allowing abortion for anencephalic pregnancies. Argentina had also made positive changes. Chile is debating their abortion law right now. So we also have to learn. Like for example, Mexico, abortion it's legal in the country. Mexico City obviously has abortion for the men of the women until in the first trimester, but there are different reasons because why abortion is legal in the different states. So obviously this change, but there are in most of the states abortion is legal in cases of rape, and when the women's health is on risk. When they have anomalies in their pregnancies, etc. So my recommendation is like for you as future provider is to learn more about the laws and policies and the standard guidelines in each country, to make sure that we are not going to create barriers when this don't exist. So the other thing is that information and education is an important role that medical providers can play. And for example, Uruguay, before they changed their law, they used to have this harm reduction approach that they were implementing in the services, where healthcare staff will provide information on women about medical abortion. Medical abortion has been proved that has reduced maternal mortality in the region, because even like when women cannot access to services in the public healthcare centers, they can get information about medical abortion. And obviously this depends on each person, but it is a good way to also to reduce maternal mortality and provide safe and evidence-based information to women. And just for people who had never heard about medical abortion, this is abortion. It is recommended by WHO, of the World Health Organization, and it is using drugs to self-induce abortion. Mexico City use it in their public health centers. Like they do medical abortion and for women until the 9 weeks, and they're in one of the sources that Carlos included. I think that you can find it there. If not, we can obviously share this information later. And I think that also there is a lot of that it can happen to prevent also unwanted pregnancies, and it is providing information about contraception, especially for women that are minors, who usually are the ones who face most of the barriers. And indigenous women and women from African descent or transgender men also face a lot of barriers in the whole service. So we had to make sure that they will receive the care that they need to prevent these unplanned pregnancies and unsafe abortion too. I hope this is helpful.
Thank you, Ceci. Carlos, do you have any last comment that you would like to add?
Ah, nosotros. Diego. Okay.
So
Can you repeat the question for us?
we couldn't hear what you said.
Do you like to say something for the last comment?
Yeah, if you liked this webinar, I invite you all to work on the subject way more, and just keep in mind that we will be having IPAS workshops in the regional meetings and OPAs. If anyone is interested to attend as a participant, feel free to apply. And
I think always be like, mind opened and heart opened, to take absolutely everything, not only what we've said, but also like what people want, when you be, and see somebody crying, or a doctor, somebody, having a bad time, try to fit in their shoes. I feel like them, and that's empathy. And I think that's something, as a whole, we lack a lot in the world. Not only doctors, but in the world.
Well,
and
he hugs everyone that finds in the street, so maybe they can find a middle point.
But I think it's about that, I think it's about like yeah, like I don't know, understanding your peers is something really hard to do, and in this thing, like in you being like a future health worker, you need to like have that skill like on top every single day. And I really think like we are moving in that direction, like forward with this, and as a society as well, look forward with this. And ask your mom, ask your, like your sister. Like, if you have faced some kind of situation like this, they'll probably tell you their needs. There will be probably today speak to you guys about. So I think that's it.
On my side, it is. That's all we have to say.
Yeah.
Okay, thank you. So just to finish this, just to remind you that we're having the feedback form, which is gonna be sent to the PAMS to the America server, and also we're trying to send this to the IFMSA America's page in Facebook, so you can submit your feedback for this webinar. And just to finish that, if you have any comments, you can contact both the SCORA D and also the regional system for SCORA from the Americas. And also, if you want to say something else, Jess? Huh?
Yes, there is one question in the chat. It's actually for Ceci, for our iPass external. The question reads, do iPads have workshops related to legal framework in America's region? Because I think it's really important for us as medical students, since we're not trained in this field. I don't know, Ceci, if you have anything to add to that question?
So I can prepare a list of some of the materials that we have from the Americas. IPAS don't have work in all the countries in the Americas, but there are a lot of information about abortion and access to safe abortion in the region. So I can put together a list and send it to Carlos, and he can share with the SCORA. So you have that. We recently published a publication on criminalization of abortion, and there is a lot of good information on the role the medical staff play. I would say negative role. Denouncing women who come to the services with after having an unsafe abortion, looking for post-abortion care. And there is a lot of good information on how also medical providers, post-abortion care is part of like emergency care that any woman or any person should have in the services. So this is very important for medical students or all the healthcare staff to understand. And obviously, we don't want that health services are a place where women feel that they can face a prison just to looking for care. So we have a lot of information, and I can share it about medical abortion, about access to services, and more information about and data around the region. So I will be sharing this next week with Carlos, so he can share it with everyone.
Thanks, Ceci. I believe there's one more question from Alejandro. It reads, hi, I'm Colombian, and I want to ask Cecilia what strategies we can use to include the teaching of access to safe abortion in medical schools and residences in gynecology and obstetrics.
So I have to say that the process varied school by school, and I think that the most important thing that you should do if you're really interested in to have more information and that this is included in your medical curricula is to learn a little bit of like how decisions are made, what will be the process for you to advocate for this content to be included in your school. So talk to your professors, not necessarily saying about the topic, because I know that this can create some resistance from some people, but at least like getting to know how, like, when the curricula will be reviewed the next time, who are like the people who will be more open to talk about these issues. Like, for example, if there are professors that are interested in working on human rights or women's rights or women's health. So talking to them and understand like when the curriculum will be reviewed, if there are opportunities, for example, to have like sessions that are not necessarily part of the the classes, but like you can have extracurricular sessions or opportunities to participate in trainings and getting to know the work of other like professor from like OBGYNs or others providing services. Like Colombia had like really good experience on implementing reproductive health services, also services for young people, and they have increased the access to safe abortion in the country in the last years. So I think that there are a lot of opportunities to learn, especially because therapeutic abortion is legal in Colombia, and this definitely can be included in the curricula. I think that also the even like the training, the Youth Act, the training toolkit that IFMSA and IPAS put together, it is not necessarily clinical specific. It is a good way to start with the capacity building on the topic. And there are other NGOs in Colombia that are providing also legal services in the country, and it would be good to also get close, work with them at the local level to, for example, visit some of the clinics and being able to be trained on abortion services. I think that's the best way, by getting to know how your medical school work and how it is possible to advocate internally. I think it's the best way to start.
Okay, guys, so if you want to contact Ceci, please do it through Carlos, our awesome SCORA array. You may contact him at SCORA. You may contact him, sorry, at array.scora.pamsa@gmail.com. So please feel free to contact him if you want to reach Ceci, if you want any information from IPAS. If you have any further question after you review this webinar, please also keep in mind that this webinar will be recorded and will be saved on the IFMSA YouTube account, so you can share it with your peers that couldn't make it now. So please feel free to share our webinar with all your SCORA and all your medical students in your NMOs. So thank you very much for joining us today. I would like to thank Carles, our SCORA director. I would like to say thank you to Carlos, our amazing regional assistant for the Americas region. I would like to say thank you to Diego, our awesome involvement assistant that had the idea of creating these webinars to make standing committee sensitive topics more close, more relatable to all our medical students in the region. And also, even though she couldn't be here, I would like to thank Misha, our liaison officer for reproductive health issues, since she was the one that made the initial link with IPAS, and she's the one that is also always working with IPAS as our external for IFMSA. So thank you very much. As we said, we will be sharing the slides through our Yahoo emailing group and also through our Facebook group. So please keep in touch if you want to receive those. Also, Ceci just shared her email account on the chat, so you could contact her directly as well. And thank you very much for joining us today. That will be all from my side. I don't know if Diego wants to say any last words.
Just don't forget to fill the feedback form. We're gonna send it as soon as possible. Yeah, that's all.
Okay, so thank you guys. Have a great Sunday, and see you on our next webinar from the Americas. We will be picking a very nice topic for you all. So we will love to see you in our next in the next opportunity. Thank you very much.
Thank you. Bye.